Also in Houston, Dr. Gerard Francisco, Chief Medical Officer at Tier Memorial Hermann, and the lead doctor on Congresswoman Giffords' rehab team. Doctor, good morning.
Good morning.
Since the shooting almost 3 weeks ago, we heard in Don's piece a second ago, the progress has been labeled lightning speed. What's been the most, I guess, impressive improvements that you've seen with the doctor over the last 3 weeks that you've kind of now been brought into the mix?
Well, I've seen improvement in practically all aspects, improvement in her movement, improvement in her ability to participate in our therapy program.
You plan on putting a speaking valve into her breathing tube. Can I ask when you do plan on doing that?
We do not know yet when that's going to happen. That will be dictated by her further recovery. The other members of my team are closely monitoring her overall condition, and when it's ready and safe for us to proceed with that part of her rehabilitation, we will do so.
Can I ask what you feel is the likelihood that she'll actually be able to speak when that valve is implemented?
Well, right now we're still assessing her overall condition, so I really cannot assign a timeline for that.
How has she been able to communicate?
Right now, she's able to communicate in therapy. We're able to engage her in the therapy program. She's able to follow the instructions that the therapists provide her, and she's been participating quite well.
I know you've seen a number of patients in your career that have had significant brain injuries. Again, we hear the words miraculous, remarkable in charting the Congresswoman's progress. Would you agree with those assessments?
I would, because in the almost 20 years that I've been in brain injury rehabilitation, I have seen miracles in terms of the recovery of my patients. They may be small miracles, there can be big miracles, and that's what I look forward to, and this is what engages me in this field, because many of my patients have surprised me in terms of their recovery, and they themselves get surprised with how much they recover even many years after the injury.
And the Congresswoman has been surprising a number of people so far with her progress over the last few weeks. You got started with the rehabilitation as soon as the Congresswoman arrived at the rehabilitation center at Tier. Can I ask, what are some of the things that you were able to do immediately when you first saw her?
Well, the first thing that we did is to make sure that she will be able to tolerate all the physical activities we had planned for her. The physical therapists who have also seen her over at the other hospital before transferring to our rehab center started a program that is designed to help her practice how to move once again. Of course, this therapy will be upgraded in the next few days as she tolerates more and more physical activities. In addition to physical therapy, the occupational therapists have already started their program. In the brain injury rehab program, occupational therapists are the ones assigned to teach our patients how to perform things, what we call activities of daily living. Things such as brushing your teeth, dressing up, cooking, washing clothes, that kind of stuff. And speech pathologists are also involved in the program. And the speech and language pathologists are the ones who are in charge of challenging our patients to be able to communicate effectively once again. They're the ones who identify the best means of communication. Yep. And they're also the ones in charge of looking at the swallowing program.
Well, Doctor, thank you very much for spelling it all out for us. We wish you and your team the best of luck. It sounds like you've got a lot of wonderful people that are working on the Congresswoman there, and we thank you.
I work with a lot of talented people in our hospital. Thank you very much.
Thank you, Dr. Gerard Francisco down at Tier Memorial Hermann in Houston, Texas.